of the governor's mansion, where they attempted to heckle my family and to get me to come out. When they found out I wasn't home, they hung me in effigy just hundreds of yards from where we are standing on your Capitol grounds. Another man who made threats against me and our Kentucky State Police was arrested at his home where he was making grenades. These groups are not freedom fighters. They are terrorists. They are not security forces. They are threats to our nation. So, this nation and every single one of its leaders, including everyone here in Kentucky, must in one voice denounce all of these groups. Domestic terrorism is about violence and intimidation, pure and simple. There are no two sides to it. There should be no state leaders or lawmakers pandering to these violent extremists. No posing for photos, no speaking at their rallies, because wrong is wrong. I will say it again. I will not be intimidated. I will not back down. I will continue to do the right thing. We cannot allow domestic terrorism, which threatens our way of life, to be cast in terms of patriotism or applauded on any level. It is our job as the people that make up this nation to do the right thing and send the right message. With that, we're going to turn it over to the Lieutenant Governor to start today and our briefing with our Fast Four at 4.
Thank you, Governor. All right, so with the Fast Four at 4, the very first one is the Team Kentucky Fund, and I have some great news to share. We partnered with the Community Action of Kentucky, and they have served as the hands and feet of our operation. And I'm happy to announce today that we have officially given $1 million in aid to Kentuckians through the Team Kentucky Fund. And this money is helping our friends, our family, and our neighbors. One story came to my attention about a single mom from Wayne County, Kentucky. And this woman lost her job as a data entry operator when COVID hit. She fell upon hard times and couldn't pay her utility bills, but she heard about the Team Kentucky Fund and applied, and she received assistance. She was able to pay her utility bills, and it was a big relief that she didn't have to continue to worry about that on top of everything else. So this is one example of the generosity of our fellow Kentuckians and what we're making possible when we come together. I want to thank CAK for their hard work, and I want to thank the Public Protection Cabinet for overseeing the Team Kentucky Fund. And here's one of the best statistics I've heard so far. For every dollar that's donated to the Team Kentucky Fund, it results in $1.92 in aid to Kentuckians. That is a remarkable return on investment. So if you've fallen on hard times financially because of COVID-19, please visit teamkyfund.ky.gov to apply. If you want to help your fellow Kentuckians, you can make a donation at donate.ky.gov to give. Every gift is tax deductible, and 100% of the proceeds go directly to support Kentuckians, just like this woman in Wayne County. All right, next up we have the RISE Awards. We all know amazing people who work in our Kentucky schools. And it's our job to recognize those who go above and beyond every day to help our students and to make a difference in their lives. So we are proud to partner with the U.S. Department of Education RISE Award, which stands for Recognizing Inspirational School Employees. This award is intended to honor our classified school employees, those unsung heroes that play such an important role in our kids' lives every day. But we need your help to recognize all of those contributions that are made. Classified school employees are clerical and administrative staff, food service workers, custodial staff, maintenance, transportation, and health services staff. So we're asking for nominations. We're looking for nominees who demonstrate excellence in leadership. They demonstrate commitment and community involvement. A selection committee will review all of the nominations and submit their recommendation to the governor for submission to the Department of Education. So please visit education.ky.gov if you would like to nominate someone, and the nominations are due by Friday, October 16th. Third, we have one of those really innovative stories, again, from a school, because our schools are so innovative. But there is nothing more important than protecting our students, whether they're learning at home or in person in classes. And as I've always said, education was made to meet this moment. And here's the perfect example of that work. Today I want to congratulate the Pike County School System on the Pikeville Medical Center Healthy at School telehealth program. With this telehealth program, students who are attending in-person classes and become sick will have the opportunity to be seen virtually by a PMC medical provider without having to leave school. This will allow parents and guardians and caregivers to pick up their sick child from school, pick up any necessary prescription they may need, and go directly home. Many of the Pike County students live as much as an hour away from a medical provider, and so this is going to help when you consider the barriers of work, travel, and financial hardships. This partnership with PMC allows our students to see medical providers without having to leave school. Those providers will communicate with the school nurse or designee, and they will see the students through a high-definition video teleconferencing system that's sponsored by PMC. This is going to be available to all elementary, middle, and high school students in the school system, as well as faculty and staff. So this is another example of our students and our school communities going above and beyond to serve our children and making the best of a bad situation. That little girl looks like I do whenever I go to the doctor, and I'm not a big fan of it either. So, all right, finally, for number 4, we have some positive social media to share with you. I've got the first picture that I've got comes from a family that visited Fort Boonesboro, which is the site where Daniel Boone and his group settled when they reached the Kentucky River. We always like to see when our young people are being responsible and wearing masks and setting a good example even when they're out at public parks. Number 2, we have a family who has made voting a family activity. We're going to hear from the Secretary of State in just a minute about our elections, so I thought this would be appropriate. This family bought a book that's called a kid's book about voting to help their kids learn about the democratic system, and they perform their patriotic duty together by dropping off their ballot. So this is something that we do as a family. My husband and I are actually going to be dropping off our ballots tomorrow, Secretary, and Evelyn's going to go with us, and this will be her first time at the polls too. So that'll be a good experience for all of us. And last but not least, we've had some wonderful weather across Kentucky, knock on wood. And so I want to show you a picture of a family that visited an orchard in Bowling Green. And the mom, the woman in this picture is Mandy, and Mandy says even her 4-year-old wore a mask. And this is just an example about how young people get it, and we are so grateful for those of you who truly mask up for Kentucky. So that rounds out the 4 at 4, and so I will turn it over to our Secretary of State. If I can get my notes out of the way, Secretary. Thank you.
Thank you, Lieutenant Governor Coleman. Good afternoon. Great to be with you all again. I've got a short video to show you in just a moment about how to fill out an absentee ballot, but first I want to give you some fresh statistics about our general election. So let me begin first with a reminder of the deadline. If you want to vote absentee ballot, the deadline to request your absentee ballot is tomorrow, Friday, October 9th at 11:59 p.m. That is when we close the online request portal at govoteky.com. Then we move into the in-person voting phase of our election for 3 weeks. So if you want to vote absentee, that's great. We've made this option available to you in a way that really hasn't been available before. But you have to exercise that right. So please do so no later than tomorrow night at 11:59 p.m. Here's where we are right now. As of 3:40 today, we've had 623,404 requests for an absentee ballot at govoteky.com. That is not every request that has been received. Some people just call the clerk, but that's a pretty small number. So I'd say approximately 625,000 requests for an absentee ballot. Of those requests, 538,320 have been issued to the voter, so roughly 5 out of 6. And 144,749 ballots have been received back by the clerk. What if you want to find out if yours has gotten back to the clerk? Just go to govoteky.com. You can track your ballot there the way you track a UPS package. You can see if the clerk got your request, fulfilled your request, and if the clerk has got your ballot back. And again, to the point made by the Lieutenant Governor, you can return that ballot in the mailbox or you can put it in the drop box. It's up to you. We'll pay for your postage, or better yet, if you want the satisfaction of hand-delivering your ballot and knowing it's been received, drop it in the drop box, available to you from your county clerk. To give you some perspective, as of October 5th at 4 p.m., the deadline by statute when we closed voter registration for this election, we were at 3,561,028 registered voters in Kentucky. That's high. We had roughly 30,000 register in the last day, a huge surge at the end. And so we processed those numbers. 17.5% of Kentucky registered voters have asked for an absentee ballot. It's 36% in Fayette County, that's the highest. It's 4% in Martin County, that's the lowest. Let me tell you why I'm so pleased at where these numbers are. What we wanted, the governor and I, was to make sure that we had absentee ballots available for those who need them. And this is a subjective decision made by the voter. Does the voter feel comfortable based on the voter's age and health condition voting in person or not? It's up to the voter. And we've preserved that, but we also didn't want to over-test the system with having more absentee ballots than we could manage with our current infrastructure that's not really designed for elections to be generally conducted that way. So here's why this is good news. 625,000, my guess is it'll be 700,000 by tomorrow night. That's right in the sweet spot. That's enough that we see that it's working, that the word is getting out, that voters who have concerns are able to utilize this effectively, but it's also not so many that will overwhelm the system. Surprisingly, this is fewer ballots requested, absentee ballots requested in the general election than we had in the primary, even though the general election turnout will be, I think, 2.5 times the turnout we had in the primary, which was already high. So we're right in the sweet spot, I think, to have a successful election and make sure each voter gets to exercise the choice in the way that he or she prefers. So again, tomorrow is the deadline to request an absentee ballot. Starting on Tuesday, the 13th of October, we're going to have in-person voting available statewide 6 days a week. This year there's not an election day. There's 19 election days. You can go vote Tuesday, Wednesday, Thursday. It's up to you. Do what's convenient and help us space out the crowds and ensure we can have social distancing. With that, I'm going to turn this over to myself with a short video. I'm Michael Adams, your Secretary of State and Chief Election Official. I'm here today to show you how to fill out your absentee ballot if that's how you're going to vote this year. So it should look like this. Official election mail. And here's the name and return address of your county clerk. So let's open this up. Here's what you're going to find inside. First off, you're going to have an outer envelope. This is addressed back to your county clerk. And look, we paid for your postage. Inside of that, you'll also find an inner envelope for your absentee ballot. Plus, there's more. Here's your instructions on how to fill out your absentee ballot. Please read these. And please follow these to the letter. This is to help us help you make sure your vote gets counted. Finally, last but not least, here's your absentee ballot. It's two-sided. Don't forget to turn it over. On the first side, you've got all the different candidates you get to vote for various offices. And on the reverse side, there's 2 constitutional amendments. Make sure you look at both sides of your ballot and exercise your vote. All right, take a blue or a black ink pen and fill in these boxes. Decide who you're going to vote for. You can vote straight ticket, or you can split your ticket. And again, don't forget, there's 2 more questions for you on the back side if you want to vote in these constitutional amendments. All right, so your ballot's all done. And by the way, these ballots all look the same depending on where you live. There's no insignia that this is your vote. We don't know whose vote it is. We keep these secret. We protect your right. All right, put this back in the envelope. in the inner envelope. Just tuck this in here, and look, there's a little strip here of glue. You can lick it if you like to do that, but you don't have to. You can use a sponge. Seal this up real tight. And then note, it says right here, voter must sign here. That's not a suggestion. The voter must sign here. I want to be able to count your vote. So help us do that. Sign right here so we can compare your signature and make sure that it's you casting your vote. Now this flap, once we get this back, we tear this off with your name on it. And then you just got another ballot envelope like anybody else in the bin. That's how we keep your vote secret. Now you want to take this little envelope and put it in the big envelope. Another place to lick or use your sponge, seal that up tight. You're almost done. One more thing. See this highlighted strip here? Voter must sign here. So sign there. We've even marked it for you. All right, you're all set. Now you got a choice. You can drop this in a mailbox, or better yet, you can drop it off in the drop box we made available to your county clerk. Either way, your vote will be counted. Thanks so much. And don't forget to vote.
Thank you to our Secretary of State for his bipartisan work on ensuring that this is the easiest election to vote in that I believe that we have ever had. I believe that this is what leadership looks like, and when people can come together and put aside ideology, put people first, especially in a pandemic, these are the great results that we get. I appreciate his partnership, and I hope there's a lot that we can do moving into the future together, even beyond the current election. I want to thank Gracie Armstrong and the Atherton High School field hockey team for sending me their mask. We appreciate you. We want you to stay safe. Thank you to Gracie for being a part of Team Kentucky. Now, you may know we've had Rachel here now for about a week straight, and we very much appreciate her being here. Virginia, who of course we miss, has a message for us today, wants to give you all a little update on where she's been, and a message to people to make sure that they are getting regular health checks. We'll let Virginia explain it in her own words.
Hello, I'm Virginia Moore, and you may recognize me standing right over there where my professional colleague Rachel is standing. She's going to be signing for me today. I'm here to share something with you, something very personal. I've been a part of Team Kentucky with the governor ever since this pandemic started. As you know, Dr. Steich indicated to us during the pandemic we needed to take care of our own health. And especially here recently, we needed to go to the doctor and follow up and take care of our own health. Well, I did put off some things. But I'm here to say to you all, you don't need to. I have recently been diagnosed as having uterine cancer, but it is stage 1, so I did catch it early. I am going to be going through a hysterectomy, and then we probably will not have any need for a follow-up. So actually, this is a good thing. But it reminds me to tell you all, you need to take care of yourself. This month of October is Breast Cancer Awareness Month. Ladies, please go have a mammogram. Please go have a pap smear. Please take care of yourself. This also means that I am now one of the vulnerable ones. I've always worn a mask for you, and I'm going to ask that you wear a mask for me. My heart is Team Kentucky, and I will be back. So I will see you all soon.
To Virginia, we miss you. We love you. We know that you will be back soon. And today, I wear my mask for you. And I think all across Kentucky, you're going to feel the love that so many have and the support. We so appreciate you and everything that in many ways you started, I feel, across the country. and making sure that everyone can get the news that they need, that everybody counts during this pandemic and after. All right, moving into today's COVID report. Today we are reporting 884 new cases of COVID-19. That brings our total number of cases to 77,455. This is about 20 cases less than we had this day last week. It's about 200 more than we had in the 2 preceding weeks before that. It gives you an idea that, again, even excluding some of the backlog cases that came in yesterday, we are unfortunately on track to have the single largest week thus far in this epidemic. Our positivity rate, though, continues to stay certainly under 5% and actually creep down a little bit to 4.1%. Now, there were some questions the other day on positivity rate. We're going to talk about it in detail next week. But I had a chance to clarify with the Department for Public Health, and they are different data streams than the number of cases that come in. The number of cases are cases that have gone through the local health department. They have an individual name and person associated with them. The positivity rate is calculated by the reports from labs that come in, the total numbers they have plus the numbers of positives that they send in. But we're going to break that down for you next week and also show how we have been following kind of the total numbers that we have with what's reported electronically, and they are tracking very, very closely to where we have real confidence in this number. New cases by county: Jefferson 161, Fayette 48, Davis 34, Hopkins 32, Henderson 31, Whitley 28, Warren 25, Callaway 22, Hardin 22, Laurel and Madison 19, Jessamine 17, 13 in Bullitt, Kenton and Nelson, 12 in Ohio and Scott, 10 in Barron, Graves, Letcher, Marion, McCracken, and Webster. So a number of those counties haven't necessarily been in the double digits in the last several weeks, but again, COVID is everywhere, and it doesn't take much to have an outbreak where we see a county then for about a week in those double digits. Tough day today in terms of Kentuckians lost. We're reporting 11 Kentuckians who have died, at least in part, to COVID-19. Again, with the high number of cases, we're going to have high numbers of deaths. Even with the mortality rate decreasing, it's still at a significant level compared to anything we normally deal with. Today includes a 62-year-old woman from Bell, a 95-year-old woman from Boyd, a 60-year-old woman from Bullitt, an 80-year-old woman from Fayette, an 85 and a 63-year-old woman from Jefferson, a 58-year-old man from Jefferson, a 65-year-old man from Lincoln, an 86-year-old woman from Scott, and an 83-year-old man from Scott, and a 31-year-old man from Warren County. And there are certainly other health conditions that individual was dealing with, but COVID-19 was certainly an impact on his passing. That's 11 Kentucky families, so please be there for them. Show your empathy. Be the great Kentuckians that we are. Light your homes up green, because you never know who's driving by at that part of the night or that part of the morning. That may just help them know that you're out there and supporting them. And let's make sure we continue to ring those bells at 10 a.m. Every morning. If you know any of these families, please reach out. Tell them you care about them. Tell them they're not alone. If they need somebody to talk to, you're there. We've been there for each other thus far through this. I know that we will continue. Long-term care, which is the only area that we're going to have the update on today. 69 new residents, 62 new staff testing positive, 5 additional deaths that we have previously reported attributable to long-term care. The situation in our veterans home that we have been reporting about in Wilmore has gotten a little bit worse. We now have 33 veterans who are currently dealing with COVID-19 from that facility, and one is recovered. So there have been 34 positive veterans in that facility. We have 10 staff that are actively fighting COVID-19 and 5 that have recovered, so that means a total of 15. 10 of the veterans that we talked about are currently at the VA getting the extra care that they need. We are marshaling all of our resources to be there for them. Okay, we've been talking about masks. We've been talking about social distancing. We've been talking about, if you'll put up the top 10 things we can do to fight COVID. And we've been talking about how it's not just about you, that if you are refusing to wear one, if you're not following these guidelines, the people that it can hurt and the people that it can kill can be people that aren't choosing to not do the right things. And we've got an example today from Maine. So in Maine, there was, and this has been now reported on significantly, there was a wedding that was held that violated all of their protocols. Too many people, not the type of social distancing, masking, and other guidelines that were necessary. There are now 7 individuals in Maine who are dead who did not attend that wedding. They did not make those decisions. They can track how it went to different communities throughout the state from that wedding, including an individual who was at the wedding that lives in a home with someone who works in a long-term care facility, and how that wedding, where people made the decisions not to do the right thing, ultimately got in that long-term care facility. These things don't pop up in a nursing home or other facility. They get there by us not doing what it takes to stop the virus from spreading. These are 7 innocent individuals who are trying to do things right and who are vulnerable. And the actions of others, not undertaking a small inconvenience, can lead to something like this. So I would implore you, put on those masks. And we are, throughout the state, stepping up enforcement. And I've received a couple more questions on this. It's everything from the Labor Cabinet, which I think has either issued citations, fines, or closure orders to, I think, about 88 various organizations throughout the time, and is stepping up efforts now. It's the Kentucky Safer Hotline, which I believe from yesterday we had a slide on, which is still active. And so if you're out there and you see different establishments checking people out without a mask, we'd ask you to call us, because it is important that we get this right. The escalation that we and our country are dealing with right now can be defeated, and can be defeated without making new steps that are difficult on small businesses or impact schools or other parts of our lives. But we have to have you doing the right thing. Do it for your values. Do it for your faith, loving your neighbor as yourself. But do it. We need your help. All right, we will open it up for questions. We got about a normal size crowd here, and then just a couple over here. And Joe, we'll start with you today.
I'll start with what happened with the Michigan governor. Has the FBI informed you or other governors that you know of other threats against, similar threats against governors or people in state government?
Question in dealing with, started with what was announced about the plot against the Michigan governor today, which was a militia group recruiting and training to kidnap her, probably from a vacation home, surveilling that home, practicing their tactics, even detonating what I'd call an IED. Very violent plans that have no place in this society. And this is a group very similar to those that we have seen people in this state that are supposed to be leaders standing with and riling up. We have to be so much better than that. Now, the FBI was involved in the arrest and raid of the individual who made threats against myself, and the Kentucky State Police that was making grenades in his home, with kids in that home too. Otherwise, they communicate directly with my Kentucky State Police detail, which does a phenomenal job. At the end of the day, listen, I'm not concerned with my own safety. I have a lot of people around me that do an incredible job. What I am worried about is when we somehow encourage, embrace, or simply do not denounce groups that are engaging in domestic terrorism, then the opportunity for them to harm others grows each and every day. And it's wrong. It is absolutely wrong. Governor Whitmer and her family shouldn't have to go through what they're going through today. The threats that have been made on others and are made online seemingly just about every day against a bunch of us. The other day, I had to be taken out a different way because of one. I mean, this is, we got to be better than what we're seeing.
Since the biggest rallies that I could think of, the one including where you were hung in effigy, have you experienced, I don't know if pressure is the right word, from any of these groups, or have you experienced any more kind of contacts from these groups, more so than what we saw back in the summer?
Question is, after the rally with the 3 percenters, where they hung me in effigy, have we seen any other direct attempts at intimidation, maybe, or any pressure? Well, the individual that engaged in that about a week after stood outside my window in the back of the Capitol here, I guess trying to make a point, but pressure, no, I don't feel it. I got the right people around me. I'm going to do the right thing, and those that want to try to use fear to get me or others in this government to do the wrong thing, that is not going to work. I ran for this job to do the right thing, and I'm not going to let people bully me. If I did, they would try to bully everybody else in this state. If the governor won't stand up to you, who knows what you could get away with. Otherwise, just about everything else has been online. There are a lot of people who think that they're warriors with their keyboards, but there are serious ramifications to threats that you make against people online, and let's be better than that. Facebook wasn't made to try to attack people or threaten them with violence, and I mean, we should all be better than that. Stu?
Return to restrictions that were in place earlier during the pandemic and continual focus on prevention and increased enforcement. How can we see a drop in cases and how soon?
The question is on this attempt to step up enforcement, to continue where we are on various restrictions or capacities, as opposed to taking other steps. How soon do I want to see? The question was a drop in cases. I think our expectation ought to be a stabilization first. It's what we have seen. Do we have our stair-stepper chart in each of the escalations? With the exception of the very first escalation when we did Healthy at Home, we haven't necessarily seen a drop each time because our contacts have been greater. But what we have seen is a stabilization of where the cases are. Now, my hope is, with what last week's was a number of cases and what this week's are, we do need to see a decrease as opposed to simply the stabilization, but that's what we should see first. So if we are doing this right, if we can all wake up, if we can all do the right things and wear our masks, what we ought to see over a period of probably 3 weeks, maybe even 4 weeks, because remember, it takes a couple weeks, is we ought to see a flattening and not have that escalation we see, especially in the last 4 weeks, which looks very, very concerning. And then at that point, if we're really doing it right, we ought to see it coming back down. Now, the other part we ought to look at is our positivity rate, which is important. But this number of cases, even with the low positivity rate, means that we're in a very serious situation. Now, it does mean that we're finding more cases so that we can react to them. But contact tracing 6,126 cases in a week when you're still working with the previous week, so 11,000 in a 2-week period is a volume that we've got to push down if we are going to be really effective about it. Tom?
Governor, going back to the Michigan incident, Are you contemplating additional security measures here at the Capitol and the mansion? I know you can't describe what's being done, but are you contemplating adding more?
At this time, we don't feel like we need additional security measures here at the Capitol or what's around me. We've got great individuals. They've been wonderful to me and my family. And in times that we've gone through, I couldn't be more proud of them and their willingness to put their health on the line for my kids and for me. The Capitol, we feel good about the security. Obviously, we work with the larger Kentucky State Police when times arise. I think the going forward, we're going to have a stronger, and we're already growing it, focus on domestic terrorism, especially coming out of COVID. It's what all of Homeland Security and the national security groups talk about as being the single greatest threat moving forward. We see lots of examples of it, from hate groups to individuals to those trying to indoctrinate people online. We see some become more interested in it because sometimes the coverage seems to glorify these moments of hate and violence. But I feel good that we started moving in that direction and preparing for it before COVID hit, and that we're going to have the tools in place to ensure that we can hopefully step in at any of these moments, whether they would be a mass shooting, an act of domestic terrorism. We've got a couple examples of good outcomes where law enforcement has been there beforehand. Obviously, we did have a school shooting in Marshall County not too long ago that we want to make sure that we can prevent those from happening again. Catherine?
Governor Whitmer addressing this, addressed the comments made by President Trump at the debate last week, telling the Proud Boys to stand back and stand by. What kind of message do you think that sends to the public when the president is saying something like that?
The question is on Governor Whitmer talking about the president's comment on Proud Boys. I think that was a back and forth between the moderator and the president, so I don't want to address it directly, but the Proud Boys are one of these groups. There is no place for them. We should all denounce them. The more that they are encouraged, the more that these things can happen, like almost happened to Governor Whitmer, or other acts of violence against our citizens or law enforcement, which this group was planning. And that individual here in Kentucky making grenades that threatened the Kentucky State Police as well. I mean, we just got to be unequivocal in our denouncement. But here in Kentucky, we've seen lawmakers rally with them. We got to be better than that. If we can't say absolutely no to violence and groups that are prone to violence, militias that talk about overthrowing governments, there's no place for that in a democratic society where we're supposed to be able to disagree. And we have not just the possibility for civil discourse, but civil elections, whereby that's when changes are made. Nick?
My question is from rural Kentuckians about rapid testing. Obviously, larger cities have more availability for rapid testing in terms of driving up and doing it. In rural Kentucky, it seems that is not available, and so many people are going somewhere to wait for results for 2 to 3 days. Meanwhile, could be spreading it in rural Kentucky. Is there a need for more rapid testing in our nooks and crannies of the state?
Question is on testing in rural Kentucky. Can you put up the testing locations? We certainly have a lot of testing locations in rural Kentucky. We don't have as many drive-through sites like we have in some of our major urban areas. Monday, we're going to be talking about a program that we have just started to help address that, where we're working with at least 4 of the larger rural local health districts, increasing their access to testing, and even creating mobile units within them to hit different parts of their sets of counties where we believe there hasn't been as much testing. My belief is that that is PCR testing, which is the gold standard, the most accurate. Now, when we talk about the term rapid testing, it can mean a wide variety of types of tests. There's the Abbott Now one that only takes 15 minutes. There's the one that's coming out that you just have to have somebody watching you. Those are less accurate, but they can have a good use in certain areas where you need quick results. And so we do believe that we will be able to provide those in rural parts of the state, but for the right populations where they're needed. So think about rural nursing homes where they're being sent to, where you could test the staff every day and get that 15-minute test back. If it's pretty accurate, at least you catch something before it comes into the facility. And we've got a couple of other areas there. But we have also wanted to make sure that we have available high-quality testing in all parts of Kentucky. And so Dr. Stack will be talking about that on Monday. We've got it up and going in a couple of areas. The Christian County Health Department, which it may be the Pennyrile, that serves a big area, but located there, is one that's already up and running and has done a little bit of media to promote it.
Do you think rapid testing will not be as easily accessible in those areas as it is in major cities?
I think with the amount of rapid testing that we are getting, that we will have it available in all parts of Kentucky, but in areas that it makes sense, given that it is not as accurate as the PCR testing. And so I think where it's available is going to be based more on the activity than on the density. Areas like our prisons, with corrections officers coming in and out, we're going to try to put it around more vulnerable populations or where we just need that instant information. But we're seeing a lot of testing, and we're seeing it around Kentucky. But maybe one thing we do need to do is communicate better in every single area what all of the different testing options are, whether it's free, what you have to do to get on for it. I mean, without a national testing plan or strategy, states were left to create these types of networks. And I'm pretty proud of where we are in Kentucky based on where we started. But what it did require is that we get up and going so fast that as opposed to one major network, it's a whole bunch of different groups that are out there that have to have different IT infrastructure, because you have to get the names and the health information and the way to advise people using different labs in different places. Now that's going to be the system probably through the end of this pandemic, but in the future it does suggest that one coordinated system where you can track all of the results would not only be preferable and get people their results sooner, would have one area where you could sign up that could then go out to those that perform the tests. It's certainly something, if we face another pandemic, our response would be better. Joe.
At the beginning of this year, there was a day where about a dozen people in camo and long guns came into this room in the rotunda and were waving them around and posing for pictures. I know we have certain COVID restrictions on who can come in right now, but once we're a little past that, is there any plans to change the security rules where people cannot, a large group of people can't bring in guns?
Question is, after COVID restrictions are lifted, or if they are eased in the Capitol, are there going to be new security precautions based on a previous day where armed Kentuckians and others, really a lot from out of state, had come in? We haven't looked at that yet. Obviously, we want to balance people's Second Amendment rights with safety here in the Capitol, and we haven't had an opportunity yet. Kentucky and its rules in the Capitol are almost unique compared to many others in the country. We just haven't had a chance to do that. But before people try to spin that online, I'm a supporter of the Second Amendment. We haven't looked at any specific changes.
Do you think there's a problem with how these groups are, or the messaging around these groups? I mean, I know you're talking about, essentially calling them terrorist groups, but a lot of the times in law enforcement documents or even in the media, they're called militia groups. Do you think there's a problem with that?
I believe that that these militia groups, you choose the name, we clump them all under one umbrella. They just about all of them concern me, but they can range from white supremacist groups, which we certainly have a number, to those that even in their ideology and what they espouse are directly connected, not just to hate, but to domestic terrorism. When you have up online with your group that we're ready to take on the government, yeah, that's not being a citizen. That's suggesting and telling people exactly what you're willing to consider. And I think for a while we thought some of these groups can be harmless. It's just people loving to get dressed up and act tough. And maybe that's some of the individuals that do it, but this is unacceptable. And we've seen more of it. You just think about in the last, 7 months, what we've seen? Unacceptable. This isn't that's not America, and we've got to make sure that we fully denounce it. But again, if they're embraced by different leaders, then they're emboldened and more likely to cause violence.
Yesterday, election of mayors briefing, there was discussion about you might be insurance involved. In my Sunday school class 2 weeks ago, there was discussion about surprise bills like a couple months later, pretty, good fees. Is that the issue out there? Is that across the board?
On testing. So on testing, the question is about sometimes people being charged and sometimes not. Our state testing is entirely free. Outside of the state testing, people need to ask and get an answer before they get a test if you are insured. Many groups will bill insurance or may otherwise bill Medicaid, but I believe we cover 100% of those that are under Medicaid. Again, it's a system when there is not a national strategy and requirement, it leaves us with different approaches being taken by different providers. So I would absolutely ask. I can tell you as a state employee, we have a system that is set up to where you can get one free, but if you go to a different place, you can be charged as well outside of what we have set up. So you really need to ask before you go. But if anybody is worried about the cost of a test and otherwise needing to be tested, please call the Department for Public Health or any other area, and we will find a place where you can get one because we want people to get tested. If you get a surprise bill, I believe you can contact either the Attorney General's office on their consumer protection hotline and or our department, our Cabinet for Health and Family Services, and I think we can try to address it from there. Maybe the Department of Insurance too, with the Public Protection Cabinet. If you get listen, I believe we need to ban surprise billing entirely. And we tried to do it the last session and didn't have the support. If you get a surprise bill, call one of those 3 areas. We'll try to get you to the right place. People shouldn't be doing that, and we'll see what we can do to step in as state government. WDRB says, why is Kentucky's mortality rate so much lower than Ohio and Indiana's? I believe there are a couple things that have contributed to a lower mortality rate. I believe our expansion of Medicaid is the primary driver. I believe getting everybody in to see a doctor and regularly see a doctor means we got people's underlying conditions better controlled than in many other places. Expanded Medicaid has been a godsend, especially during this pandemic. Somebody pretty special expanded that here in Kentucky. I believe that other Governor Beshear and those decisions saved thousands and thousands of lives. I'm very proud of him and my mom. I also think, and I don't know how Indiana and Ohio's systems are working, I also think our hospital systems have done a phenomenal job in treating patients. I also believe that we have clearly communicated when you need to go and get care, and I believe that people have looked out after each other. I believe that there are so many different groups out there that deserve credit for this, that it's about us coming together, and that explains it.
Governor, with Got encouraging in testing. We still hear from time to time about shortages around the country about testing supplies. Are we all right here in Kentucky?
The question is on testing shortages around the country. First, let me say we have a little bit of concern that the PPE market might be tightening. We had a shipment of gloves that was delayed. We don't like to see that. But we saw some of those indications about a month and a half ago, and then it loosened back up. So we'll keep you advised on that. Testing supplies in some of the platforms, because again, with the way that we had to ramp up testing across the nation, there are dozens upon dozens of different testing platforms that require different supplies. Some of those are still having some significant shortages, but overall in Kentucky, I think we have a healthy supply of testing capabilities. A lot of that is driven by at least 3 labs here in Kentucky. Gravity, which the state uses, Blue Water, and the one out of Nicholasville, which is escaping me and shouldn't, because they do a really good job. And so I'm going to go ahead and apologize to them and fix it on Monday. But our testing has been, this was a major challenge that we as a state overcame. And it was everybody. It was these businesses and their businesses. It was the state trying to work with them. It was the people working incredibly long shifts. I feel good about where we are generally on PPE and testing at the moment. I do not feel good about where our overall numbers are. All right, last question is the Fayette County Health Department plans to begin using the state's contact tracing system by the end of this month or early November. Am I satisfied with that timeline? I'd really like the end of this month better than early November. And what are the benefits of the state system instead of current contact tracing methods? It allows that data to be shared instantly with the state, shared with people across county lines, since people can live across county lines. It also allows the outside contact tracers that we hired to help in all of these counties be able to step in and help Fayette County if needed, even if they are housed somewhere else. It allows us to have one major response, even if it's driven by local health departments. All right, I want to thank everybody. We won't have another press briefing until Monday at 4. We got lots of great information about the election from our Secretary of State today. Make sure you request your absentee ballot today and tomorrow. That deadline is tomorrow. Go online and do it now. I believe that there's a lot of other people out there that still want to vote absentee. You have got to get online, govoteky.com, and do it now. If not, you're going to need to begin early voting October 13th, and we'll talk about that a whole lot. It's good to hear from Virginia today. We wish her the best. She's a big part of Team Kentucky. Rachel is doing an amazing job, but I know we will both be happy when you and Virginia can sub in for each other. And finally, wear this mask. Those 7 people that didn't attend an event in Maine where people didn't follow the rules but are now dead, it's not fair, it's not right. Our actions can harm other people. Let's do the right thing. We all claim to be good people. Let's step up and prove it. We'll get through this. We'll get through this together. We'll see you on Monday.